Hello and welcome to today's IAC webinar, Ergonomics and Ultrasound, Basics, Policies, and Best Practices. My name is Kelly Baer and I am the Creative Design Manager with Marketing Communications at IAC. Before we begin, I'd like to take a moment to review a few technical matters and let you know how you can participate in today's session. We would like today's webinar to be interactive, so we encourage you to submit questions. To do so, use the Questions tab located on the left side of your screen. Please submit your questions anytime during the webinar, as we will monitor questions throughout the presentation and try to answer as many as possible during the Q&A period. Also on the left sidebar, please note the Resources tab. Click this tab for a link to today's handout, a PDF copy of these PowerPoint slides. Select the file name to download the handout. Lastly, in the lower left of the player, please note the Request Support button. If you experience any technical problems during this webinar, click this button. A technical expert will be there to assist you with any issues you may have. For those who like to take notes during the presentation, look to the right of the slides and click the Notes tab. There you will see a white text box where you can take notes on today's webinar. These notes will be emailed to you automatically at the end of the session. To be eligible for the SDMS CME credit, you must be registered, logged into this webinar, then complete the survey. A link to the survey will appear on your screen automatically at the conclusion of the live session and also be available from the IAC webinar portal for 3 business days. If you are viewing this webinar in a group, please be sure that you are also individually registered and logged into this webinar on another computer or device so that we have record of your attendance today. Today's presentation is being recorded and will be posted at a later time for on-demand viewing. This webinar is a joint presentation of IAC and SDMS. And now I would like to introduce today's guest presenter, Alicia Armour. Alicia is the Health Center Administrator at Duke Triangle Heart Associates in Durham, North Carolina. She oversees the cardiology clinic, including diagnostic staff in echocardiography, stress testing, ambulatory monitoring, device clinic, and nuclear testing, as well as nursing, medical assistants, and advanced practice providers. She also serves on the IAC Echocardiography Board of Directors as a representative of ASA. With that said, I will now turn this webinar over to today's speaker, Alicia Armour. Alicia?
Thank you for that warm invitation. So let's get started. I think we've already been through our housekeeping items. So review of objectives. The first is to discuss and understand the practical components of an ergonomics policy. We'll discuss work-related musculoskeletal disorders and ways to address and minimize them in the workplace. And then also understand ways to prevent and reduce injury from our work-related musculoskeletal disorders. I do not have any disclosures. So all of our standards encourage us to have a form of an ergonomics policy, and this can be something that we get from some supportive literature as far as how you put it into place, or you can use one of the example policies that can be found online. But as far as guidance for the policies themselves, there is a lot of resources through the SDMS, through the industry standards for the prevention of work-related musculoskeletal disorders and sonography. And then there's another separate web page that has a lot of additional pearls of wisdom in there. We also have ultrasound ergonomics checklists that you can get through the Society of Radiographers, and then the CDC has guidelines on how to prevent this in the workplace. They actually have it specific to our industry. And then I've included another resource as far as information through the SDMS. And this is that web page I was referring to that you can go to through the SDMS site, where you can look up what are work-related musculoskeletal disorders, how does it apply to sonography, how does it impact us, and then the 3 responsibilities between us as sonographers, the employer, and then the manufacturers. And then these are 2 of those documents that I've referred to so far in that previous slide. And then, of course, there's links to other resources as well. So I highly encourage you to go to that website and explore. I definitely had fun looking through all of that. But any resources you can share and utilize are great. So as far as our ergonomic policy components, I'm going to break it down into just different parts. One is our ultrasound equipment. The other aspect is the exam room and the additional equipment in that, meaning things like our exam tables or the scan chairs. The area itself, is your room adequate for all the equipment that you have in there? And then different accessories that you might choose to use or your employer might provide for you. We'll talk about protocols and exam time and scheduling, workstations, and this is more where that offline analysis component comes in, or for providers when they're reading their the ultrasound studies, how they should set themselves up for workstations, how risk management is involved and the importance of risk management, and then going through posture, patient positioning, and handling. So as far as our ultrasound systems go, I think we think of it as a whole, but there's three components that I'm going to more focus on. And one is the monitor. And that's one thing that's really easily moved up and down these days with our advanced systems. And then the next part we need to think about is the console, and where is it in relation to us? Is it, are we able to move it forward and back or turn it, as you can see in some of these examples here, so that it is functional for the different positions we have to get in depending on what we're doing for our exam. And then the other part that goes along with the console is the control panel. Is it user-friendly? Are the buttons close enough? What is my reach factor as far as what I'm going to with my exam, and trying to minimize some of that. So those are just some small parts of the large ultrasound system to break it down into. So our monitors should be adjustable separate from the control panel, and that allows us to change it if we're, let's say, moving from a seated position to a standing position. We can adjust that monitor height so that the monitor is at appropriate eye level. We also should be able to adjust the height and tilt. So not, maybe you need to tilt the monitor down depending on if you're having to sit a little bit lower with that monitor, or if you're a taller individual and you need a little up tilt to be able to see things, if the lighting isn't adequate, or maybe you have a little bit of a glare, that can help with some of that. The design of this monitor arm should allow for single-handed adjustments in all positions. So meaning that you're not having to use both hands to move it, that you can keep, if you want to, your hand on the patient with the probe and move that monitor. So it shouldn't be a challenge to unlock or to move. But for our transporting abilities, we do want to have that capability for locking so that that monitor doesn't go swinging around when you have to make abrupt stops if you're moving your machine from one place to the next, or if you're trying to, get your machine in and out of an elevator. So ensuring that that locking capability is important. And I know some people like to just use it for keeping it centrally located, but having all those options, we need to make sure our systems have those in place. Then talking about that console, as I mentioned earlier, the height needs to be adjustable. And as far as the ultrasound systems, they want to have it adjustable for the majority of us users. So that, if you think about the height range of us in our field, that it would hit most of us if you think about that normal curve as far as working from a standing or sitting position. The console also needs to have the ability for 2 or 4 wheel mobility so that you're able to maneuver it around appropriately, whether it's while you're moving it from one location to the next, or even within your room if you need to readjust so that you can move something in. If, let's say, if you're going to start an IV or something, if you're in that type of environment and you want that out of the way, or anything else that might come in. And then the base should be functional and unobtrusive. And that is helpful for, as you can see in this picture, not only for when you're having to move your system, but also if you're thinking about using some of the other equipment in the room, being able to get that chair in close enough to the machine so that you're able to work appropriately is important. And so just thinking about that as a whole with the console itself. Then the control panel should be adjustable separate from the monitor. So you can see in this image at the bottom that is able to rotate around. So that horizontal and rotational movement. It should be easy reach for your controls. So as we talk through a lot of these portions of the ergonomics policy, maintaining that neutral position is extremely important. And so thinking about that, especially if your vendors are good about asking for feedback about their systems, being able to maintain that neutral position so you're not having to move your hand very far with the one that's working the control panel. And as I mentioned earlier, that it's not a lot of as much reach if there's abilities to maybe move some from the central portion of the control panel up to that touchscreen, or ensuring that the touchscreen isn't that far away from you. But it should be geared towards all scanners. And then also thinking about minimizing, those repetitive movements. That's another big thing with our ergonomics policies and those touch points. But ensuring it works for all of your workforce as far as the ease of use and appropriate height and mobility. So moving into that exam room and additional equipment. So starting with those exam beds, they need to be height adjustable, again, for seated or standing position for scanning, and also thinking about your patients that are coming in. Is the clearance enough so that you don't have to have extra items in your exam room that may already be just adequate enough for everything that you have in there to help someone ambulate onto the bed. So that safer patient handling and transfer is extremely important. Having different braking mechanisms so that you can ensure that the bed's not going to move, but also you're able to move it if you need to. There needs to be adequate clearance for you as a sonographer to get close enough to the patient. And we all know with different views, sometimes that you might need to change, where you're located along the exam bed so that you are able to maintain that close proximity to your patient. And then things that are helpful but not always available in every context are the adjustable table back, being able to bring it up and down, the dropouts for the different positions we need to get our patients in, and then the ability to tilt the bed as well. If you need to get them into something like the Trendelenburg position, ensuring that it not only tilts up, but it also tilts back. And then from a safety standpoint, those side rails are extremely important. Not because you're planning to go transport them in this bed, but just if you need to step away from the patient for a moment, maybe because you need to look at the previous images if you're seeing something new, or have a quick discussion with maybe the reading provider about some findings that you had, putting those side rails up while the patient's on the bed to ensure that they're not going to come out of the bed if you have to step away is important. All right, and then moving into those transducers, those have come a long way over the years. And so hopefully most of these that we're working with, as much as they can be, are lightweight and balanced. We want to promote a neutral wrist position. And so this image on the left, I actually pulled from a scan example that was from one of our societies, and thinking that's not the best wrist position. So it's great for this talk, for example, of what not to do. But thinking about trying to maintain as close to zero with our wrist position as possible. And then the probe surfaces should have more of a slip resistant and fit most of our hand size, as because the grip, if it's too large, is going to be challenging for us to hold, and it can cause some issues. And then appropriate cable length, ensuring that you have enough distance to get into all of the scan positions that you need to with the patient, but that there's not so much cable that it's all over and adding weight to what you're already doing for your exam. And then Scan chairs are very helpful. There's a lot of different ones out on the market, and we want to ensure that the height is adjustable for neutral position for the majority of scanners. So again, thinking about like we did with our ultrasound system and our workforce that we have, is it going to go up high enough or down low enough for the different scanners and the different heights that we have and the modalities that you're working with if you're a multimodality facility. Thinking about adjustable features, because there's a variety. Some of them have a lot of bells and whistles and some of them are simple. And depending on, I've met people who have different preferences on what they like, but lumbar support is always very helpful. That's something that we don't always think about. Maybe you think about it when you're on a long drive in your car, or when you're sitting on the plane, but not as much when you're thinking about your everyday exam, but it is important to give yourself that support. The seat depth will also help contribute to your back support. So just looking at some of these examples here, sometimes with the more complex scan chairs, the seat itself will slide forward and back in addition to up and down with the whole seat itself. And so for certain individuals, that change could make the world of difference for their comfort for the exam. A footrest is encouraged, and again, that helps out with some of those things we've talked about where, with bed height or with the console height, being able to find that balance and ensure that our legs are at more of a 90-degree bend, so that we're not putting extra pressure on our low back, and maintain that more neutral position for our legs throughout the exam. And then being able to swivel and rotate, as we all know, is very important. Armrests can be extremely helpful, and you can see in these examples I've given you here that there's some that are a little more extensive that have more mobility and might go out farther, and then there's some that are closer to the body, and you can adjust with that. And then of course we should have a locking mechanism, because it's always, you don't want to start doing your exam and pushing, on the getting your hand ready to go, and then the chair itself starts to slide because we don't have that locking mechanism in place. So to keep yourself safe and in the right position, that locking mechanism is important. All right, so then there's additional equipment that we can invest in that will help us us and our patients, I would say, with ensuring that we're having the best level of comfort for the exam. So wedge support is highly helpful, especially if you're working in a place where maybe you don't have all the bells and whistles on your bed. So instead you've got that wedge support for a patient's back. And some patients need a little bit more support than others. And so having that additional wedge support is helpful, whether it's for their back or under their knees or between their knees. Of course, pillows can help, but the wedge is really nice because it's got that, definite angle to it. If you have team members that like to stand during their exams, anti-fatigue mats are great. That way they're not standing on plain concrete or wood floors or whatever it might be. I think a lot of us forget, especially if you're someone that stands or is takes a lot of steps throughout their day in their workplace, that shoes are extremely important, which I didn't include on here, but having good supportive shoes and then that anti-fatigue mat to give yourself more cushion and support your body is important. And these are all things that are easy to clean. You can see in this example in the middle that there's a support device that you could include for your arm for support, and that could attach to your bed, or another device to help you out with that. And I know one of my sonographers, she likes to use this with the cable, and I think people have different opinions on that, but that is another supportive mechanism that takes pressure and off of the body and transfers it somewhere else. So let's get into protocols. So depending on your modality and your institution, you have your standard protocol that's kind of your baseline. And then hopefully with additional pathology, you might have some specialized protocols, or maybe you follow the guidelines that are established for your modality for working up those different portions of the exam for what you're seeing as a sonographer, but ensuring that your protocol is meeting standards, of course, by IAC and hopefully your society that you are engaged with, and also thinking about that we're, not just taking images to take images, right, as well. So kind of thinking through that as you're doing your exam. Also thinking about things like limited protocols, when those are appropriate, depending on when was the last time this individual may have been scanned. Do they need a full everything, or is there a specific question at hand that needs to be answered, and there's not any change in the patient's clinical presentation, so you're able to do something more limited. So we can look at our IAC standards and guidelines for great examples of a standard protocol, and then I've just thrown up one for echo as far as some guidelines and standards for performing transthoracic echoes. And I think everybody tends to be somewhere in between there, but knowing what that baseline, what you need for a bare minimum, and everything you need to add depending on the pathology is really important. All right, so talking in next with our exam time and scheduling, this always tends to be the hot topic, so had to put a little cartoon in there with that. As far as standards out there, IAC echo standards for complete transthoracic echoes timing is 45 to 60 minutes from encounter to departure, and then an additional 15 to 30 minutes may be required for complicated studies. Vascular, we're encouraging you to look at the SVU guidelines, because depending on the exam type you're doing, there's a recommendation on that exam time based on the exam you're performing. The SDMS and the ASC also endorse certain exam times based on modality. You need to think about time for non-scanning duties as well, as far as a management goes. If you are someone that expects your sonographers to do preliminary reporting, are you building in that time for them to be able to do that as well as the actual scan itself? And we encourage you to minimize excessive, difficult, and portable exams, as we know that that is the most taxing thing as far as that goes. So thinking about someone's day and scheduling, and is there a way to rotate tasks possibly with your staff if you've got a more than one individual? Is it something where you split the day and you're portable in the morning and you're in the room in the afternoon, and that's your buddy switches off with you? Or what is the limit that your facility has? What number are they expecting as far as portable exams? Thinking about what works for your team, but trying to mix it up so that we're not always doing the same thing. And I think as you look through your day, if you're someone that looks ahead at the people coming through that you might be working with for your scans and seeing what you have, maybe it's something where if your templates line up, you're able to talk with your colleague and say, oh, I have, this many AS patients in a row. Do you think we could flip-flop one of these patients so we could mix it up a little bit and think about what we have for that work up for pathology as well as the scan time involved. All right, let's move on to workstations. And I think this is something that we indirectly think about but don't think about as much. And especially, this is your time that you're not touching the patient, and it's just as important to think about how your body's set up versus when you're actually patient facing. Of course, lighting, thinking about that in general for in your room while you're scanning, and then afterwards and whether you're working on a workstation in the room that you did your exam in, or if you have to go to a separate place, ensuring that you have appropriate settings for that. Dimmers are very helpful. I know when I'm working with my sonographers, I always encourage them to look at how their readers are set up in their lighting environment, because that's really what the end goal is to set up my gains for optimal reading after the fact and what's on that PACS system. So just thinking about that, but also getting that break. And I know we all like to scan in the dark, but kind of taking an opportunity to get out into those lighted areas is probably healthy for those eyes as well. With your desk, ensuring that the height is appropriate for you and the depth, that you have enough space to work on your desktop, whether you need to, have whether you besides just the computer itself and keyboard and mouse, do you have room that you can write things down if you have maybe a list of your patients for the day or anything else that you might need? Our chair, maybe you use the same chair for scanning that you do for your workstation, but maybe you have something different, and ensuring if you do have two separate chairs that your chair is supportive, it's still adjustable, that there are armrests, just like we think about with our scan chair, the same should be with our workstations. And then setting up your computer in the way that you would your ultrasound system so that the monitor adjusts. Most of our monitors adjust up and down, or there's great little elevation platforms that you can invest in, or your facility can invest in, so that if your monitor height is not high enough, you can elevate it up further. There's arms that you can attach monitors and computers with. So there's a lot of additional accessories that can ensure that that monitor height is appropriate for all users for that workstation. And then thinking about the keyboard and mouse, encouraging into that neutral position, just like we did when we were talking about scanning, which we'll also dive into later, but getting, that neutral position is kind of across the board as far as when we're, thinking about working, whether it's offline or with a patient. And then I've just put a little image in here for standing work desk, because, everyone might have this, or everyone, but we have these opportunities now with these sit-stand desks, and getting that opportunity to stand is sometimes a really nice break for you or for your readers, especially if they're maybe in an institution where that's what they're assigned to for the whole day, is reading the ultrasound studies. Having that ability to go from a sit position to a stand position is refreshing. It also gives them an opportunity to, work different muscles and take that pressure off if we get fatigued from sitting in a chair. But setting up that standing desk in the same fashion we would for sitting, as you can see with this person here, that they're eye level to the screen and that they're appropriate tilt and everything. All right. So risk management is part of your policy as well. And as a sonographer and as an employee, it's really important to understand where you report injuries, because every workplace should have a place where you are able to report workplace injuries, and or if a patient, let's say, falls, that can fall into risk management as well. Usually these are reported in different places, but it may be in the same place. So thinking about where do you need to report your injuries, and encouraging your colleagues to do this at the time of the injury to see if they need to be evaluated by employee health or a provider. Also ensuring that annual education is provided, like what we're doing today, but maybe you take it a step further, and in your work group you provide, maybe you're able to grow as a sonographer, and that might be part of your clinical ladder, where you can provide that education to your colleagues on ergonomics talk and take it a step further. Assessment of the area discussed. Maybe you have an ergonomics department that's part of your institution, and they come and evaluate your workspace and stations. They look through your protocol, your scheduling, exam rooms, and equipment. They're also really nice resources. Sometimes with whether it's through employee health or if you have an ergonomics group, they can sometimes arrange for you to try out some of the things we've discussed as far as chairs and exam beds. They may have some contracts in place where they can do that. And so asking if that is available before you're taking that investment in on a piece of equipment, to ensure that most of your staff is going to like it and use it. And then encouraging one another to budget for ergonomic supportive equipment and design. So when your managers come to you and say, I'm working on budgets for the next fiscal year, what are some ergonomic pieces that we're lacking, or maybe there's a baseline number that's always available, or if there's something that's worn out more, you address that at that time. But it is important to think ahead for those things, just like you would if you were thinking about investing in an ultrasound system. We would think about this as well. All right, let's move on to the part where we discuss posture, patient positioning, and handling. And so this kind of comes down to that part for us. So posture is our responsibility. And as we've already talked about, neutral is key. So we want to avoid a few things, including prolonged awkward or static posture. And I know that this can be challenging to sometimes, especially when you're going portably, but thinking about taking micro breaks so that you're not in that prolonged position. Uneven seated or standing weight distribution. You may not realize that when you're scanning, you put your weight on your left leg or your right leg if you're standing, or you lean to one side more than the other. And so doing that self-evaluation when you're in front of that patient throughout the exam is really important. Or ask your colleague to come in for a couple minutes, or your manager, to do that assessment and look at your posture, because you might be surprised at some of the tips that your coworker can give you on ensuring you're more in that appropriate position where we can be as neutral as possible. And then we also want to avoid the sustained reach, twist, and excessive force. And thinking about that, because these are all things that can cause those work-related musculoskeletal disorders. So getting again into that posture and positioning, what we can do is thinking about using bringing that seat height up. So the neck, the head, our control arm, you can see in this image on the right here that this looks like the sonographer might have their hand adjusting the ultrasound system there, or someone has their hand there, maybe it's a physician. But ensuring that we're getting everything to the right height. Maybe we need to bring the bed up higher, right? So that if you don't, maybe in this example here, you're not necessarily sitting on the bed, but if you can bring your chair closer to it and the patient closer to you, so that you're at a appropriate height, so you can maintain that neutral position of both your neck and your arm, and keeping everything aligned would be best. Straightening your wrist, thinking about how you're positioning your wrist, where is my arm, and am I able to straighten my wrist if I move my arm one way or another, if I bring it out or in. But encouraging the patients that are, of course, able to be mobile, move closer to you. A lot of people, especially I think as we start, we're timid in asking the patients to do that, but do you have to think, if you're uncomfortable, they might be uncomfortable as well. And they might also forget, right? Maybe they get comfortable throughout the exam and they start rolling into a different position, which makes it harder for you to image. And just getting them back into that position, taking that 10 seconds to get them back into that position might make all the difference for your exam and take off time for you as far as patient contact time. So thinking about having those patients move closer to you and setting them up optimally in the bed so that you are aligned appropriately. And then I've included a website here that kind of goes through some different ways to scan and set your system up, as you can see with these diagrams down here, for a couple different modalities. Other things that we need to think about for positioning and handling, because it's not just about when they're on the bed, right? If you are, in the ambulatory setting where you're walking your patient down the hall or wheeling them in a wheelchair, what are you doing for falls training? Is your staff doing annual training? What kind of system do you have? Do you have a buddy system? Are you doing a lift or transfer training? Do you have lifts available in your facility or in your complex? How do they work? And how do we work with those? And then ask the patient to assist. So if they're able to assist, definitely have them help you out, because it shouldn't fall just on you or you and your buddy. And so there's some great information out there. I think for most of us, we're in our institutions, there's usually some good education along falls training, and all of this, not only for onboarding, but as part of your annual updates and trainings. But knowing what you have for resources and who's able to help and how the patient can help you is very important. Now, what if they're immobile? Because let's be honest, not everybody who comes in is going to be able to move. Maybe they roll in one of these bed examples here on a stretcher that is not the stretcher that you would like to work with as far as going up and down, or they're just not going to be able to get out of their mobile chair that they rolled into, or it's not you don't have the tools to move them from that chair into the bed safely for them or for you. And so in those situations, considering what's the best mechanism for you to do this so that you can get their exam done appropriately, you're not going to put yourself into a compromised scan position. So do you get a second sonographer or a student or a fellow or someone to help you, someone who can hold the probe and another person who can run the machine? You know, if you think about that time it would take for you to struggle through that exam versus two people, it's probably worth the cost to have the two of you get it done in half the time than one of you to struggle for minimally the time for one exam, if not possibly more. Using a step stool, do you have something that can bring you up higher so that you're able to do this from that height, that additional height perspective? And then that chair with increased height range is also important. So pulling in something like that, asking the patient, you know, how far back does this chair go? Are you able to get into more of a supine position in this? And they will, the most of them will be able to tell you whether they're able to go back far enough. So I know I just threw this in here because I know that not every situation is ideal, and these are things that we don't think about all the time, but when they do come up, it's good to kind of have a game plan going into it on how we can make it, you know, more comfortable exam in one of those challenging situations. So let's talk through what work-related musculoskeletal disorders really are. And these are injuries or disorders of the muscles, nerves, tendons, joints, cartilage, and spinal discs. And if you think about that, that's a lot of areas of our body. And the work environment and performance of work contribute significantly to the condition, and or the condition is made worse or persists longer due to the work conditions. And so that is our definition of these work-related musculoskeletal disorders. And so we need to think through, you know, our day, and do I have pain when I'm scanning, and where is that pain, and what can I do about trying to minimize that? So what are some of our common sources? Well, we've already talked about some of these, but those awkward or sustained positions and postures are completely it. Of course, repetition is a common source, and that's, you know, getting to some of those components we talked about with hand movements and reaching for things, you know, that repetition, trying to minimize that. How much force is required or not? How much force are you trying to minimize? For those of you who work, you know, with pediatrics, using our body to ensure we're not applying too much force. And then that contact pressure, that's one that I think we're not always cognizant of, because as you can see in this nice image from this paper here, work-related musculoskeletal disorders and sonography, it's sustained contact between your body and an external object. So it's not just your hand on the probe and the probe on the patient, it's your body against the bed or your elbow resting on something, you know, thinking about those points of contact pressure, your arm resting in something else. And that can also be a source for these injuries. So there's some great diagrams in this paper. I highly recommend all of you to look through that and read that. So talking through, this is again from the SDMS site here, are our responsibilities as sonographers are avoiding scanning positions that cause pain. And again, thinking through that as you're scanning, taking the time to adjust your system, your bed, the patient, so that you are not uncomfortable. And those little movements can really make all the difference. As you see in this example here, that wrist flexion, you know, ensuring that we keep that neutral wrist, trunk bending or twisting, some things, you know, are you able to have a mobile chair to scoot back, and if you're having to move down the exam bed for part of your exam, instead of twisting and turning to do that part, and is your machine able to move with you? Thinking about that shoulder abduction so that it's less than 30 degrees, because when we get past that 30-degree mark, it's really hard on our shoulder. And then that excess force to acquire an image. Thinking about encouraging the patient to help you maybe with some of the moving or holding something so that you're able to apply less force to obtain that image, it's not a bad thing to consider asking them to assist as well, because they want to have a good exam too. So how do we address this? Well, education, you all are here tonight, and this is a form of education, but as I mentioned earlier, you can educate one another about it. There's a lot of forums that we can have these discussions on as far as work-related musculoskeletal disorders, and maybe your team has thought of something that somebody else hasn't, as far as some workarounds or some great pearls of wisdom to share with one another. So doing an evaluation of your environment and can your manager evaluate you? That maybe that's part of your annual evaluation. Hey, can you check on me quarterly when I'm doing a scan and make sure that I'm setting myself up right ergonomically? Or can your ergonomics department come in and work with your team on things? Or employee health. Of course, you can ask your colleagues as well. And thinking about reporting those injuries, it's still very important to address that and ensure that that's being recorded. I took these images here from several different modalities and wanted to point out, hey, this is some great wrist positioning, so that's good, but what else can we look at in this image? Well, is this sonographer close enough to the chair where their back is supported, and could the system move closer to them so that they're more supported and everything's in more of a neutral position? Or can they get a little bit closer because the shoulder is kind of coming out there? With this one on the top right, thinking about keeping that upper arm at more of a neutral position, thinking about it being in line with your torso, you can see that this one, it appears to be pushed back a little bit. And so can we position our chair more appropriately so that we aren't having to bring that elbow back farther? And then as you can see, with this person, they've got their arm out to the side a little bit more. So can we move our body closer to the patient so that we're, getting underneath that 30-degree range for our shoulder and our elbow? And then as we look at these two images I took from random scans, when I just searched, ultrasound exams, these are kind of the different images that came up and ways that we can help one another. So maybe I walk in with this sonographer up here on the left, and I notice that, hey, their neck is bent and not in a neutral position the way they're looking at the screen. I also notice that their shoulders are not in alignment. And so do we need to bring the bed up higher so that this is more even? Then looking at this next, so monitor positions, posture, shoulders are uneven, and bring up the bed. Then with this one, there's a lot to notice in this fetal exam here. The monitors way over to the side. Now I know machines, we can only do so much with what we've got to work with, right? But thinking about ways maybe the monitor could get moved over a little bit so that it's more in line with you looking forward, or can the machine move closer to the unit? Thinking about your wrist positioning, I know that's not always easy to maintain depending on how the baby's positioned in this unit. And then thinking about our contact pressure, where can we minimize those touch points for contact pressure? And then this is from Jeannie with the venous insufficiency duplex exam. So thinking about getting some tools that can make it more ergonomically friendly, so you're not having to reach like this individual is on the left, and with Jeannie and her example on the right here, where she's in a better position, maybe not as much with the neck, but otherwise getting after that and trying to give herself more of that neutral position. So set yourself up for success. Think about muscle recovery. Micro breaks are great. Take those 30 seconds to readjust your body, check in to make sure that you've got everything set up as it should. Do stretches between maybe when you switch windows and you stretch your wrist out, or you stretch your fingers out, or you stretch your shoulders out. That 10, 15 seconds of stretches might really help you out over the course of the day. Are you going to incorporate strength training? What are you doing outside of the office or at the office? And then taking that time to stop and relax. Maybe you do that while you're sitting and working offline on your EMR or at your PAC system, and taking that time to relax and really using that lunch break to stop and relax and not continue on with what you're doing. So those micro breaks, what can we do between windows or views? As I mentioned, you could stretch, think about realigning your body. I know when I go from, my regular the most of my scan, I'm sitting, but then when I switch to, I do echo subcostals, I'll stand up, and so I realign my machine, my monitor. I change the bed height so that I'm in my neutral position as I finish out the rest of my exam. Are you doing measurements offline or online, or are you doing it throughout the exam? I think with COVID, we've all been a little bit more aware of this and are thinking about doing our measurements after the fact, so we're not having that touch point on the patient and minimizing that actual time per hand on the probe and doing our measurements after the fact. So thinking about making those adjustments and giving yourself those micro breaks. Some stretches that we can do, whether this is, in not something you could do this throughout the day or in between patients if their patient needs to stop and use the restroom on the way back. A great time to take a stretch break, or you could do, this neck and shoulder or even upper back stretch between our windows. The forearm and wrist one, this one's great to do between those windows as well if you really needed that break. Using the wall to stretch your chest. You can also interlock your fingers behind your back and pull up and out to stretch out your chest. That side bend to stretch out, especially if you've had to get in some of those awkward scanning positions, will help. We don't think about our hamstrings getting tight, but if you are in a sitting position most of the day, that part really does get tight, and it also affects your back. So thinking about stretching, the back of the thigh, which is your hamstrings, and getting that stretch in will definitely help. So strength training, what can we do? Well, you could have this at work. Maybe your workplace has a program that is gives you positive things for doing these type of things at work, or maybe they'll provide some of these things for you. So you could have something like bands to work with for strength training. I know I've seen on social media some labs will do wall sits together. I think that's awesome. I used to do that with my team. We do some wall sits, walking lunges. I'll do wall sits sometimes when my patients are changing. As you go to walk down to get your patient, if you're having to go get them and bring them back from a lobby or somewhere else, you could do walking lunges or squats along the way. And it also makes your colleagues think about it, right? If you're doing these things like, hey, I should be doing some of this too to keep myself healthy and strong. You don't think about it, but if you're sitting in a chair and you start rolling forward and pull from your heel, that's going to work the hamstrings, the back part of your leg that we just talked about stretching. So that can help with that. You can do wall push-ups, you can do dips. There's a lot of stuff you can do with just your body weight and things we have at work to help incorporate strength training between exams, or when you've got some downtime, if you have downtime at work. And then outside of work, you can do some of these things I've mentioned at work for strength training at home, or maybe you've invested in some system that you can use with weights or kettlebells or bands. Maybe your facility or your employer helps support gym memberships, so you get some discounted rates sometimes for that, or maybe that's something that's just something that helps you with your work-life balance. Other things we don't think about are yoga and Pilates, how that strengthening and stretching, how that really does help support our body when we're in work, and how great it makes us feel afterwards and makes us ready for that next day. And there's various exercise classes too that help support strength training. So these are all some options to encourage that, but this is on us to try to ensure that we get this in so that our muscles are strong and supporting that spine, our core, our head and neck and shoulders, so that we're able to stay strong and healthy for our jobs. All right, so in summary, there are several components to a good ergonomics policy, and I know we've covered a lot, and I probably have only, touched the tip of the iceberg, but with limited time, we've tried to at least touch on as much as we can. So looking at our equipment, the exam room itself, how is it set up? What is the lighting like? What kind of things do I have in here that are ergonomically friendly? What is my ultrasound machine giving me? Is it compatible for most of my users? What's our protocol like? Where are we meeting our standards? And what additional tools do we have that can keep our protocols efficient? Workstations, are they set up right for ourselves, for our readers, ensuring that not only when we're in front of a patient, that we're considering how we're set up for that non-contact patient contact time, looking at the time that we're allotted for our exams, ensuring that we know what risk management is in our institution, how we get in touch with them, where we report things, examining ourselves with our posture and our patient positioning and handling. So a good ergonomics policy is a collaboration between the employer, the employee, and our vendors and manufacturers. And we kind of started with that from the beginning of the discussion. Addressing these musculoskeletal disorders early on is really important, and it is a continuous process. So you need to find your advocate in your facility. Is it your medical director? Is it your supervisor? Is it your colleague? Who's going to advocate for ensuring that we're in taking care of ourselves and continuing over the years to take care of ourselves. And remembering that prevention is a daily task, even exam by exam. So taking it patient by patient so that it's not overwhelming, because all of that information can be overwhelming. Set yourself up for success and recognize what could be changed or improved about the way you scan. And remember to take in those micro breaks and incorporate some of the ideas presented today. And I've included a list of references that were kind of interspersed throughout the talk, but also we're kind of on those front few slides. But definitely visit these websites, utilize those references for your policies, and share with your colleagues, please. And we're on to question and answers.
Okay, great. Thank you so much. And at this time, we will begin the Q&A session. From IAC, I'd like to introduce Katie Gibson, Director of Accreditation for ECHO, and she will assist with the Q&A session today. Katie, would you like to start us off?
Yes, absolutely. Thanks, Kelly. First of all, thank you, Alicia. Excellent, excellent presentation. Great overview of the policies. I definitely want to thank SDMS for sponsoring. And of course, all of you who are attending today, thank you so much, because I think the first step is just having a conversation about it, and how do we change this is education. I'm going to start off sort of with a hot topic question, Alicia. I hope you don't mind. Several people ask this all the time. I see it all over social media. What is the number of studies I should do in a day to keep myself healthy? So how would you like to weigh in on that?
That is a tough one. So I think addressing it more from the stand of the time you're allotted for your exams, because if you are allotting the appropriate time for your exam, depending on what modality you're doing, you should be set up for success for the appropriate number within a day based on the hours that you're working, right? So looking at those guidelines and standards for the exam time is a great place to start to see what that looks like, and your schedule template that it's built in that way.
All right, I've got another one I'm going to throw at you that's kind of a hot button question. What would you say to the person in your facility or that you've heard online saying, I've been scanning for 30 plus years and I've never been injured. I don't know what you're talking about. I can do a study in 10 minutes. What do you say to those people? How do we break that cycle?
So I think it's twofold. One, I would ask them, what are you doing to keep yourself in such great shape that you're in this profession 30 years and have not had a work-related musculoskeletal disorder or injury on the job? Because clearly you're doing something right if your body feels great 30 years into it. And so you should share what you've been doing over this time to ensure that you are set up for success. I don't think it's ever a great thing to make it a competition for the number of patients that you're able to scan in a day, because I don't feel like you're really taking and putting the patient first and yourself first in that context, because it should be about doing the best exam for that patient that's in front of you and giving them the appropriate time to ensure that they have all the information that's needed to answer the question at hand for the reader. And so so twofold, I would say, great, let me know what you've been doing and share with it so I can share with others on what you're doing to keep your body healthy and set yourself up for success. And what are you giving your patient due justice, and are you really following the protocol that your facility wants by getting it done in a certain amount of time, or seeing, getting that many patients into a day?
I think that's a great answer. We do have a lot of questions about portables. I know that there are some facilities where they're doing all portable all the time. Should it be common practice to have access to some of the friendly tools? Like, should you bring a chair with you everywhere you go? What do you suggest? And then I guess a second part to that question would be, what if there's a lot of equipment in the room? Like there's a ventilator, there's a dialysis machine, there's 10 family members. What do you do to kind of combat those obstacles?
That's a great question. I definitely have faced all of that in my portable days. I think a couple things, if this is your institution, it's a team, right? Like, it's not just you and your department. You're working to provide that service for those units. And so working with your manager, working with those floors, especially if they're frequent flyers that you're going to address some of those things. Is there a place that you're able to store a chair that works for your team, and knowing that you might need to use it in a couple rooms that day? Is there a way to work with the nurse who's taking care of the patient so that you can get in the best situation closest to the patient while not disrupting some of the other things that they have them with the dialysis machine and the ventilator and everything else? And as a sonographer, are you willing to maybe use your non-dominant hand so that you can get into an ergonomically friendly position, and not be stuck with, I've got to scan with this particular hand all the time? I know that was something that I adopted and have encouraged with my staff and students who I'm training, is that, if you're proficient with both hands, you're going to be able to walk into any room and take care of that patient and set yourself up for success. So, that's not always ideal, of course, and I understand that, but having those abilities and thinking that work through can be very useful, because maybe you're able to do that. But don't be afraid to talk to the care team and asking them to help you get set up in that room so that you're able to give them the exam that they need and they want, and asking the nurse to help, if you need to get the patient in a better position, or from the, maybe they're sitting in a chair, they need to get back in the bed, or ask the family to leave because they're disruptive. That's not with outside of our realm of asking, because we all are one big team, right? If we're working in that environment as a health system.
Great tips. There are some questions about how to get the employers to really pay attention to this. And I know that SDMS has several resources on that page that you showed, but and I can help answer this question too, but do you have any thoughts on how to get your employer to listen to your reasoning as to why you need some of these accessories, or you need to, vary your exams and take stretch breaks and things? So what would you say to that?
I think to your point, Katie, looking at what's published as far as, and this is honestly and outside of just our modality or our expertise, it also goes into other workplace. But the bottom line is, if employers take care of their their employees, they are less likely to have injury. They're less likely, they actually have more engaged employees. Their absenteeism rates go down. There's a lot of benefits that have been published, and it's not like it's, published yesterday. It's been published for a while about investing in your employees in that capacity, but also thinking about, if they're very budget driven, looking at some of the resources that are out there with what the cost is for injuries and what it will cost them to have a sonographer out, or versus what it costs to have some of the smaller tools that are available. That is something that's helpful. Also, just thinking about, if they're looking at volume and a budget in that aspect, out of that budget that goes into the volume we're producing, what does that cost look like for some? It makes the numbers look kind of small, right, with what you're asking for. So sometimes it depends on who your audience is and how you can advocate for them, and that would be my first, or to them, thing I would say is find out, who you're appealing to and how to present it to them, and then utilizing those resources that are out there to present it to your employer or your manager.
Yeah, great answer. There's a lot that SDMS page has links to a lot of that research. And then I do want to say that OSHA, the links from the SDMS to the OSHA website also have resources for work-related musculoskeletal disorder in sonography. But there is also this thing, and I saw a question pop up about, just like we have our vendors come in and teach us how to use the machines, can we have someone come in and assess our ergonomics? And I do know that OSHA has a program where you can have, and it's for free. I believe it's for free, but it's not like you're reporting anybody to OSHA by doing this. You can have an assessment of workplace safety, and I believe ultrasound is included in that. And I think, Alicia, there are also, private, companies and things that you could hire to come do your ergonomic stuff. Am I correct in assuming that as well?
I think so.
Okay.
I mean, I would have to look into it further, but I would not be surprised. I mean, if you think about corporate fitness in particular, that which can be associated with health systems, that would be an avenue I would look at with that. Is there a program that would support it? And then, your local is there an ergonomics group that you just are unaware of in your facility or in your institution that could support that too?
Yeah. All right. Well, before I turn it over to Kelly, I do want to hit one more topic. It's not really a question for you. It's more, I just want to point some people to a resource that we have on our IAC website. That underneath of the webcasts, accreditation or recorded webcasts, there are a couple of recorded things on our YouTube channel that may answer some of the questions that came in about venous reflux studies and tips and tricks, because last year, Alicia and her teammate Jeannie did a great webinar 2022, and then Jeannie did another one in October of 2022 that is very specific to vascular imaging and really touched on some of those how to optimize your technique when doing standing reflux studies. So please check out those resources. If you need help finding them, contact us and we'll point you in the right direction, as well as some of your very IAC standard specific questions. Just hit us up anytime and we'll help you with that. But again, thank you so much, Alicia, for your time and your expertise. We really appreciate you. And I'm going to kick it back to Kelly to tell everybody how to get their credits.
Thank you.
Okay, great. Thank you, Katie. Thanks again, everyone. And a very special thank you to Alicia Armour for this presentation today. Please feel free to contact IAC with any questions that were not answered during the Q&A session. To receive continuing education credit for attending this webinar, please complete the survey. The link to the survey will appear on your screen automatically at the conclusion of the live session and also be available from the IAC webinar portal for 3 business days. On the left side of the My Account page, you'll click on Webinars. Look for the title of this session, Ergonomics and Ultrasound, Basics, Policies, and Best Practices. Beneath this title, you will click Review Event. On the left, select the Evaluations tab, then click Take Evaluation to complete the survey. Your certificate will then be emailed to you directly from SDMS. processing within 3 weeks. If you have any questions about the survey, please contact us at webinars@intersocietal.org. Once again, we thank you for joining us today and appreciate your participation.